up from, so what do you love about being a respiratory therapist?
So as a respiratory therapist, we can take care of the cardiopulmonary. We can go in and we don't work in just one area. We work on the floors, in the ER or the ICU, and so we may see you on Tuesday in the ER, and we may take care of you then if you're sick enough and you get intubated. When we come back the next time we work, we may take care of you in the ICU, and then when it's time to go home, we also may have you on the floor. So you're able as a RT to follow the patient along with their disease process and how it progresses to see them walk out the door. So that's very fulfilling that you get to see them out their worst, but then you also get to take care of them and get them to their best to go out to their family.
Okay. So tell me about the ECMO program, because we already had a pediatric program, so tell me about bringing the adult program.
So it was just kind of a natural progression for the hospital to start offering adult ECMO. They had it periodically for the heart patients, but they didn't have a formalized adult ECMO program to offer for patients that only had sick lungs. And so Stephanie and I were approached last September to help start and educate the formal adult ECMO program by Dr. Patel and Jennifer. So it worked out after we took our class in Tennessee that initially we weren't supposed to take an adult class, we were supposed to take a pediatric class, but that didn't work out. So we ended up taking an adult class, and so then we were able to bring back all the knowledge that we learned there, and not only knowledge, but we also made several friendships and professional relationships with therapists and nurses that we met at this company that work at different institutions across the nation. And so now we have relationships with them, and we can email or text or call them and ask them with questions. And so we have people at larger institutions that are able to help us start the program here.
And you're the only nationally certified ECMO specialist in this area, right?
Well, now there's two, because Stephanie also passed the board as well. So yes, the American Society of Perfusion started offering the certification for adult ECMO in March, and we both sat for the board and passed it. So now we are both certified adult ECMO specialists.
Okay. And so how did COVID change, or did it change the ECMO program?
I guess it helped jumpstart it. We started our first patient we had in January. We have had 6 patients on ECMO since January. And so we were already in the process of getting our program started, which was very good since COVID came, and it is a respiratory virus. And so we have been able to offer ECMO to COVID patients that don't respond or haven't responded to the other modalities or treatments.
So when you run the machine, somebody has to be there with the patient for 12 straight hours, right?
That's right. So when you go on ECMO, you can go on for either heart failure or lung failure, or it could be a combination of both. And so this machine is basically what is keeping the patient alive. And so you want to be right there at the bedside so that any troubles that arise, you can catch them and hopefully catch them before it turns into an emergency. And so if you're not right there beside the patient, constantly watching your pressures and watching your vital signs and your monitors, and you won't pick up on those slow progressions. And so you want to stop them before it becomes an emergency, because if the ECMO pump stops, that the patient then becomes very critical and could deteriorate very fast.
Jennifer told me at one time that there was only 2 of you, I think, that were going back and forth for a couple of weeks. It was one would take day and one would take night
Yes.
for a couple of weeks.
So my partner Stephanie, she works night shift, and I work day shift. And so when we started, we were the only 2 that could sit ECMO. So we have trained a total of 15 specialists that have come through our class and done our water labs. And you do water labs monthly. It's not just, oh, I did my 5, I'm done. And you always want to do those to maintain, because you're constantly learning. You have to do refreshers so that if you go a long period of time in between patients, you still keep that up front in your memory so that you can just do it without even thinking of responding to an emergency. And so we had to get people trained to be able to sit or become a specialist. So we now have 6 that can sit solo, including myself and Stephanie. So yes, at the beginning of it, it was very hard and tiring, because not only were we sitting ourselves and managing the patient, but we were also orienting new people on how to become specialists. And so now, since we have a total of 6 people, we have others to jump in and take over, and then we still have more left to train.
Okay. Wow. Explain again what the water labs are.
So with a water lab, you are using the real pump and the real circuit, just like you would on a patient, but you're using, we call it water, but it's normal saline to act and serve, and you have some sort of reservoir to act as your patient, so you can simulate any emergencies that could arise. You can simulate air or disconnects, and we also have certain emergencies and pressure changes that we can simulate to kind of help teach and train people, and what to watch for, which vital sign changes is a reflection of a problem with your circuit. And so we do that with the saline or water, just to keep it fresh in our memory.
And how has COVID changed your job or changed your perspective?
If anything, I think it has brought so much attention to the field of respiratory therapy, that now people, when you say I'm an RT, people have seen on the news, they've seen on all the stories of COVID patients, they now know what a respiratory therapist is. Whereas in the past, everybody just thinks doctors and nurses work at the hospital, and so now they are being more aware that there's so many more fields of expertise, and that takes into account taking care of the patient than just a doctor or a nurse.
Okay. Is there anything you'd like to add?
So I guess being a respiratory therapist, our hospital also has a transport team.
Okay.
For the children's hospital, for the NICU and the PICU. And a respiratory therapist, we staff both teams, the NICU and the PICU. So I can take care of the smallest baby in our NICU, 23 weeks, all the way up to our oldest patient on the adult side. And so some of our patients we have met them when they were born as a preemie, or maybe they were born with a congenital heart defect and they have all their care here. And so we see them grow up and transfer to the PICU, and then we see them all the way through their stay on into adulthood.
That must be very rewarding.
It is very.
Okay. Well, thank you so much.
Yeah, thank you.